Good morning, friends and colleagues across the world. Pablo Kraster, DDS, New Hyde Park, New York, here with you today. On behalf of Global Summits and Dr. Keanu Shah and myself, I welcome all of you today here. We have a wonderful show with a very dear friend, an expert in the field of dentistry, and also many aspects of the legal aspects in dentistry and running offices, and he's got a ton of experience, and we'll introduce him shortly. A couple of housekeeping announcements. The Global Summits, as you guys all know, we started with dentistry, but now we're branching out into medicine, chiropractic, pharmacy, etc. So we invite all of you to nominate doctors that can bring something to the table, that can help us educate our audience. So we welcome that. So please nominate yourselves or nominate friends that you believe will benefit healthcare overall. So we are referring to healthcare here as a whole. Another thing that I'd like to do is congratulate all the top 100 doctors for 2022. They have been all selected. And as you guys see, we have been showing small teasers here and there. So they've worked hard, and salute and congrats to all of you guys. We're also in the process of doing the inaugural class for the Universal School of Health, which is the Doctorate of Healthcare Business. That's the degree that one will receive. And this is for all healthcare professionals that hold a doctor degree. They can take the course. And this course is designed to teach you what you didn't learn in school. Because as you guys all know, in professional school, whether it's medical, chiropractic, dental, or, it doesn't matter. We are taught how to practice our scope of expertise, but we really walk away with very little knowledge when it comes to running a practice, expanding your practice, buying a practice, selling a practice. These are things that no one teaches us how to do, how to manage our offices, how to perhaps consider going into the direction of intellectual property and, do something with that if one is interested. So we're trying to have different experts from different theaters to bring their knowledge and skill sets to the table, and essentially share that with our students that are going to be signing up for the 2-year course. On another note, the faculty of the DHB and the Universal School of Health are going to be giving a special Paranar series. We'll each talk about what we will be doing in our courses, and it'll be sort of an overview and a Q&A as well. Another very important aspect that I want to mention for all you guys, for CE credits, as you guys probably have heard, we are now offering CE credits for the Paranars, and there will be a link posted in the comment section where you could sign up for your CE credits. And our newest, one of our newest projects that we are now running is a project that offers a Hippocratic accreditation and a seal of acceptance. And what that means is this applies to companies, to teaching institutions, anyone in healthcare that wants to go through our process of rigorous examination and making sure that the Hippocratic Oath at the end is respected in the way they conduct their businesses. They can feel free to contact Global Summits and go through our process, and hopefully we'll issue the seal of acceptance. So that's something very new, and there'll be more on that later on. So as you guys all know, the global climate that we're in currently is very turbulent on a political level, on so many levels. But we're not here to talk politics. And as most of you know, if you put 100 people who are in a room and you start talking politics, they're going to get into a fight. There's going to be a brawl. But we don't do that. We're doctors. And this is the advantage of the D2D, doctor-doctor movement that Global Summits and Dr. Shah pioneered. And this essentially unites all of us in healthcare together, and we become much stronger as a whole. And as I have used in a past Paranar, I believe, when you go up to a beach and you look at the whole beach, you see a lot of sand. But if you grab a piece of sand and you put it in your hand, you can't even see it. So when a doctor is alone, this is what you are, a grain of sand that no one pays attention to. But with the doctor-to-doctor movement, we unite across the globe, and we become a force that you don't want to mess with, because we won't allow you. And when I say mess with, I'm not threatening anyone. I'm just stating that dentistry and medicine and healthcare should be practiced ethically. We have a Hippocratic oath to follow, which means doing no harm to a patient. All right. And our patients have to be treated with respect and dignity, and we have to provide the utmost health care possible. Now, in my humble opinion, when we treat a patient, we develop a relationship very often for life. And we know the patient's history, we know the patient's dental history, medical history. We know how slowly or how fast their, for example, periodontal disease is progressing, and we monitor them, and we tend to focus on the future of how we treatment plan in this case. This, of course, depends on patient age, patient health history, and many, many factors. What I'm trying to say is, when I started out in dentistry, you open an office, you either bought a practice or you started from scratch, which is, each one, I'm sure Dr. Davis will maybe touch on some points regarding this issue, but it was a different landscape we practiced in. And then insurance companies started becoming more and more powerful. They started dictating our lives, dictating treatments, and essentially causing for the doctor-patient bond to become weaker. And I have personally lost many patients because of the insurance company parasites that lie to us, that lie to our patients in regard to receiving x-rays, not receiving claims. And very often they make us, the doctor, the provider, look like a fool. And very often this leads to patient loss. That is unfortunate. We're going to stand together and put a stop to this. Okay, insurance companies must be held accountable for their actions and for the lies they use on a daily basis and create stall tactics so they don't pay out their claims as they should. The other fundamental problem that has been occurring in this country for many years is the proliferation of I shouldn't say group practices, DSO operations, these clinics popping up here and there. And for the most part, many of these DSO parasites are operations that are run by corporate America. They have nothing to do with dentists running them. They have nothing to do with quality patient care. All they care about is money and the bottom line. Patients in such an environment are very often treated by 10 dentists or 10 clinicians, and really no one gets to understand what this patient is here for. Everyone is rushing to make $1 and thinking about their wallets. And I see this in my practice on a daily basis, where people are treated very poorly with substandard dental care, and it breaks my heart. So these are things that I think Dr. Davis will address strongly. Dr. Davis is an expert in this field, has been studying it and fighting it for many, many years. And Dr. Davis, please say hi to our audience and welcome.
I want to say hi to the audience. I want to thank you for joining us on this day. You're taking time away from your family, your activities, your leisure, which is very important to, recharge your batteries. You're going to go back into work next week, and those batteries need to be recharged. But you took time out to be with us today, and my sincere thank you to all of you.
Well, I had the pleasure of watching the earlier partner that you did with Global Summits, and I was so impressed. And I said to myself, this is a man that sees things the way I do. This is a man that has so much potential and so much education to share with our younger audience, especially those in dental school or medical school, the young folks that will come out and be faced with, what do I do next? Do I go into private practice? Do I buy a practice? These are all things I think we can discuss momentarily. But guys, let me read you Dr. Davis's resume. And Dr. Davis does have an extensive resume that's probably one of the 3 longest ones I've seen. So
No, 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 no.
I have a shortened copy here, but I would encourage for the organization to put a link with his full resume so you guys can really.
A little bit's okay, but my focus is what can I do for you?
Yeah.
I don't need accolades. I don't need any of that. It's what I can do for you.
Thank you so much. Thank you so much. So let me just briefly tell our audience a bit about you, and then we'll get into our discussion. So Dr. Davis graduated University of Massachusetts, Boston in 1975 with an undergrad degree in biology and a minor in German. He worked as a forensic chemist and later research assistant at Massachusetts General Hospital. He entered dental school in 1978 at the Ohio State University School of Dentistry and graduated in 3 years. Wow, that's admirable. Served in the USPHS in Oklahoma, private general dentistry practice in a small town in Maine until 1997. Relocated to New Mexico in the year 2000. From 97 to 2003, employed as an associate, where I assume faced many abuses towards associate dentists. Reestablished in Santa Fe, New Mexico as private general practice in 2003 and still there today. He practices 1 day per week in the clinic for disadvantaged. I see firsthand the abuses inherent in the broken Medicaid system, he says. Consultant to attorneys and other organizations, as well as a dental expert witness for cases of malpractice, fraud, and unlawful and unlicensed practice of dentistry by corporate entities. Dozens of articles on protections for the public and doctors relating to abuses of corporate beneficially owned healthcare. Dentistry Today News Online, Dentistry Today, Dentist the Menace, Dental Town, Concerned Dentists for Texas, LinkedIn, etc. And then, of course, there's a link to his resume. Disclaimer, this is Dr. Davis' disclaimer. Because of signed non-disclosure agreements, Dr. Davis is not free to discuss specific companies, law firms, settlement agreements, etc. Most doctors realize the system is dirty. They just don't know how much dirtier it is than they already realize.
It's true.
Dr. Davis, that's very impressive. If please feel free to add anything that you'd like to share with our audience, and then we can start our discussion.
Well, I really want to know, we're here for you, all right? You hear that, but you need advocates that are on your side, that don't have hidden agendas, that aren't out there to be a parasite off of you. Some of you know that from as early as your own dental education. I'm not saying the faculty so much as the administration, they were not always acting in your interest, but their own interests. And that extends from the recruiters that brought into the dental schools. Some of these entities, they pay money to the school. They pay backdoor money to administrators at the school, and they get into the schools. This is not healthy for you. You're not disclosed that information. Not good. Then you may work for certain parties that you have no business working for. They're going to eat you up alive.
So let's I want to focus for a minute about someone potentially graduating school next year. So as a young dentist or as a young physician, years ago, it was a different climate. You hung your shingle, you started a practice, kind of that was how it was done. Some people decided to join a small group practice where, again, quality of care was probably much higher than it is in a DSO clinic where no one knows anybody and doesn't know the patients. So that's very different. But I think in dentistry, how do we protect the young generation when they come out so they're not used, abused, and chewed up and spit out the other door by one of these large companies that are essentially corporate America telling dentistry and physicians how to run their lives?
A young doc, middle-aged, older doc, we all need mentors. We all need people that are surrounding us, fellow doctors, and they don't have to be in dentistry. It can be medicine, it can be podiatry, pharmacy, whatever field. We need to be surrounded by mentors that have our interests at heart, not their own interests. And there's to manipulate you, to churn them and burn them, as it's called. You're a doctor. There's a status with that, although that's being largely, it's being eroded by corporate, by insurance industry, to some extent by government, and sometimes very ridiculous regulations. Even our institutions. We've got institutions now that are pushing dental therapists. We've got a glut of dentists on the US market. And yet, the institutions, we've got 3 new schools that'll be opening up in the next 2 years, one in Texas, one in Missouri, one in North Carolina. And we've got a glut on the market, and they keep pushing this nonsense of access to care. Every time you hear that word, access to care, hold on to your wallet. Someone's going to try to sell you something. They're going to sell you a line of nonsense. Look out for that.
Access to care can mean just the fact that you can walk into a clinic, but no one is telling you the quality of care you're going to get once you enter the clinic. I think that's a serious issue that people, patients, I think, must be educated. I think a lot of it stems from there. The other thing that I find some patients do is they only care about what it costs them. They don't necessarily care about the kind of treatment they're going to receive. They care about money. How much is it going to be? Can I do it cheaper? Now, I'm fortunate enough myself that I started from scratch and I built up a practice which is in the middle of the scale in terms of fees. And that works for me. And I've established a quality practice where I know every patient, where I treatment plan every patient, and then I execute that treatment plan. And I think that's very, very difficult to accomplish when a patient enters the doors of one of these parasitic organizations that are only out to, for the bottom line, to make the buck. And they don't give a rat's, in order to treat that patient like a human being. And I see phases, sort of, not phases, rather these waves where certain patients are told the same thing as they go. You need 014, you need 014, you need 014, you need 014. That's wonderful for some people, but it doesn't work on many others. And I'm personally not a fan of 014 because 013 is nothing. So I generally, there's many things that I think need to be explained much better to patients, and their options must be given. And I think that unless we do that, we fail as dentists. And the younger colleagues out there, I think, is something very important. You have to be very cautious not to get involved or misled into making poor decisions on empty promises without contracts, because then you have no leg to stand on. And maybe Dr. Mike can touch up on this.
Two things. Number one is we've got a fairly broad audience, so some people don't know what an all-on-4 is. For our non-dentist colleagues, it's 4 implants with a implant supported complete denture. That's basically what it is, and that's what they recommend for each and every single one of their edentulous patients. And there's more options. That's just one option. Contracts are critical. You're going to get faced with whatever field you're in, an employment contract if you're going to work with a corporate employer. It's imperative, absolutely essential, you have a specialized attorney review that contract. It's going to cost you $2,000 to $4,000. That's a lot of money coming out of school. I fully appreciate that. If you don't spend that money, it's going to cost you potentially many, many tens of thousands of dollars to get out of that contract. These contracts are one-sided. They're weighted towards the advantage of the DSO, we call it Dental Service Organization. But you have medicine has medical service organizations. You see this throughout the industry. Can these contracts, it's boilerplate. Don't worry about that, doctor. When you hear that, you run. Don't trust that. What's in that Oh, this can't be enforced anyways. You won't be in a position financially to retain attorneys after the fact to fight it. So don't get into that kind of a contract to begin with. If it doesn't make sense, don't sign it. Don't get into it. And they're looking to hook you in. They're looking to prey upon your naivete. Oh, we're so-and-so. We've been in business for 35 years. If we were dishonest, do you think we'd still be in business? Yes. Yes, you are. And you are dishonest. And it's disgusting.
And I believe, based on what I've had heard from Dr. Shah many times and from you during the last part, that in 47 states in the United States, it's illegal for a non-dentist to own these operations. So what they do is they stick a dentist with a rubber stamp to cover, and they get around the law. And how do we address that?
That's got to be. It should be addressed at the state and federal level. That's a violation of Unfair Trade Practice Acts. It's a misrepresentation in ownership. It's not going to be. They put too much money in the hands of too many politicians. It's being addressed routinely today. You won't see this. You won't see it because these cases do not come to trial. But I guarantee you, the DSO, as well as the private equity companies, are named in the civil actions, and the cases go up to that level, and they settle. And it's in the case of, let's say, a wrongful death case. And yes, we have wrongful death cases in dentistry. It can be some serious money. As an expert witness, I'm not privy to the settlement amounts. But in order to pay off all the experts and to conduct this litigation, it's hundreds of thousands of dollars, millions in some cases.
So I think the younger colleagues today, the astronomical debt they've incurred to get their degrees is astronomical. So yep. These kids are coming out of school. They are under tremendous financial pressure on how to start their life. So obviously, if you're going to buy a practice, it takes a substantial investment. Now, if one is independently wealthy, then you really shouldn't be, listening to this lecture, because when you're independently wealthy, you can do anything you want. You can sit there and wait for 10 years for your practice to build, but that's not, I think, most of us. I think most of us, some of us have had fortunate parents that have paid for our education. I think that's not most of us. I think most of us have some debt. So when we come out of school, or when you guys come out of school, you start worrying. I have to make a living. I have to pay for the car. I have to support my wife and kids. I have to do this. I have to pay the loans. So many of you younger folks, I think, may be tempted to end up falling for these contracts or these job offers that maybe are offered by DSOs, and be very cautious with what's being offered to you and what the fine print says. And Dr. Davis, please tell us a bit, how do these organizations attract the young graduates? What do they do? What are their tactics for convincing or soliciting our younger friends to join such?
This debt is outrageous. It is killing our professions. We have news organizations that keep touting dentistry and other professions as well as in the top 10 professions for earning. What they don't look at is the debt to income ratio. And dentistry is one of the absolute worst. It's far worse than medicine. These debt levels are outrageous. It's like an anchor around the neck. And you're a drowning person in the ocean. You got an anchor around your neck. That's what this debt is doing to you. It often forces people into decisions they should not make. They look at the money. I can't afford to do the ethical path. I can only afford to go in with this corporate entity and work for them and pay down my debt. And what you do to pay down that debt is you're selling your soul in many cases. You're hurting the public. I've seen doctors who do not fully recover afterwards. We're talking drugs, alcohol, depression, suicide, marital problems. It's not a pretty picture.
Well, I
It's
think this,
very ugly.
I believe that as far as last time I checked some statistics, the suicide rate, unfortunately, in the dental profession is extremely high. I guess many people don't realize how stressful it can be to work in such a small space for 20, 30 years.
You've got people on your back, produce,
Right.
produce, produce. You've got something called a daily dashboard. And they're monitoring. Corporate people are monitoring your production on a daily basis. They knew everything you do, everything. You don't make quota, and that quota can be tacit. It may be said or not said, but you'll know what it is soon enough. You don't make those quotas, you're out the door. You're gone. You're booted.
Now, with that quota comes responsibility. And here's a question that I have for you. When, let's say you're one of the doctors in a setting, in a DSO operation with these 10 doctors, let's say. So most likely you will be treated by multiple of doctors in that clinic. So let's say that a year later, a lawsuit arises. And because for whatever reason, and 10 doctors have worked on this case. So is that going to drag you into the lawsuit?
Absolutely. Every one of them. Every one of them is going to end up, depending on the severity of the case, every one of those doctors is going to be under deposition, is going to have legal representation. They're going to lose heart lining. They're going to lose stomach lining. What was my degree of culpability in this situation? You don't want to be in these operations. And it can get real nasty. These doctors are under tremendous stress. I know one that ended up with some stomach cancer over this type of worry and stress. But this doctor also succumbed to the temptations of gross overtreatment of patients as well. It was a child's Medicaid clinic, and pretty ugly stuff. Let's just say infection control was very remiss. Lots of people got hurt. I mean, seriously hurt. And it's very ugly. You don't want to be in part of that. You want to be away from that, distance yourself from that. And the doctors, I know, there's many doctors who are watching this. They know what goes on. And they're not speaking up. They're not speaking out. I understand that. There's a healing process. Some are so traumatized from these DSO environments. Some of the worst are the Medicaid DSOs. Horrific. Sorry, I have some allergies. But stay away from some of these outfits. You're going to hear this. You're going to get the spin, the corporate spin. We're going to help the underprivileged. We're going to, you're going to be part of solving access to care. No, you're going to be like a sharecropper's mule. They're going to work you into the ground. And they're going to work you on roller skates, room to room to room to room. Some of the situations are every case gets treatment for the maximum amount of steel crowns and pulpotomies that can be done. Caries, non-caries, whatever. The other major scheme in the private sector is they basically place sealants. Multiple teeth, deciduous teeth, permanent teeth, basically sealants, upcode those to, used to be just one surface fillings. Now it's 2 and 3. They'll put it on any surface that is not interproximal. Medicaid does nothing. The oversight is abysmal. The MCOs, the managed care organizations, they're really in bed with the large DSOs because of the way they're funded. So they're not doing anything. There is no oversight, or virtually none, until there's a problem. And then it gets exposed. And who's in the front line? It's you, the doctor. You're going to be the one who's, before that attorney in a deposition, and they're going to grill you. And it's not pretty. Your stomach will be churning. You're going to be nerved up for weeks in advance. It's not a fun adventure. Don't put yourself in that situation.
One question that I want to ask you, because you are an expert in this field and you've obviously been involved legally on many occasions. The system that we have in the United States, where attorneys take medical malpractice or dental, for that matter, law cases on contingency basis, doesn't that encourage a lot of patients to sort of go out and just try to sue everybody they can to get a couple of bucks for any reason, because they have nothing to lose? So that really bothers me. And I propose one thing. Sure, you could sue anybody for good reason, but for when lawsuits are raised with reasons that have no merit, and the case is lost, I believe that the dentist's legal services should be paid for, because otherwise, if you take 100 people and they can make a couple of dollars without costing them anything, they're all going to go for it. That's human nature, unfortunately.
Well, you think it looks like a lottery. Go for the lottery. Why not? There's certain issues. All right. I'm going to tell you, 97% of all dental malpractice and dental fraud, and there's a lot of it, never gets litigated. And the reason is the costs of litigation are simply too high.
Yeah.
The plaintiff's attorney needs experts. Experts cost money, serious money, many hundreds of dollars per hour for those experts like me. I'm not cheap. So a frivolous type of suit is going to end real quickly. You've got your malpractice carrier, their attorneys, they're going to confer with their experts who they have on retainer. And they're basically going to say, if this is frivolous, it's frivolous, don't settle. And the attorney for the plaintiff can spin their wheels if it's a frivolous suit. They're not going to make a dime. They don't want to waste their time on that. They want to. Those are the ones that you're talking about, Pavel, are the ones that they're not going to go to deposition. It's just the initial thing. They may try to intimidate the doctor. Let's do a settlement. Let's see what we can get out of them. Those are frivolous cases. Don't settle those things. And your malpractice attorney and insurance company, they'll tell you the same thing. But there are other cases which do have merit. And on those, if it does have merit, I would advise a reasonable amount, settle it. Get that out of your life, get it behind you. Can you have an untoward event in clinical practice that do doctors drop an instrument on a patient's eye? Yes, they do. Where's the safety glasses? We forgot them. Doc, it's not good.
I was guilty, I tell you, and this is something that you bring up that I must mention, because I like to tell my friends and colleagues the truth. For many, many years, I kept forgetting to use safety glasses. And for the last 5-6 years, we use them routinely. And sometimes, you say to yourself, gee, how easy is it to drop something in someone's eye, or a piece of filling flies into the air and goes in someone's eye? So these are little things. Or
it's
for
not
example,
even you. What if you're training a new dental assistant?
Correct.
And the phosphoric acid, the acid etch that you use every day in dental bonding, a drop goes in the patient's eye. Yeah. Not good. That's not even you. Or the dental hygienist has an untoward event.
Yeah.
That's not you, but you're responsible.
The other thing that's a very simple thing that we all hear and learn, but some of us don't practice: put a 2x2 gauze in the mouth when you're doing an extraction, because sometimes that throat can be a vacuum cleaner for sucking things into the wrong pipe. These are small things. I just figured I'd mention that. It's kind of not part of this discussion. But
when you're in the corporate environment, you're on those roller skates, you're in that corporate environment, you don't have time for that stuff. Oh, those are extras. We don't have time for that. And they're turning, and your staff who can, and I know Pavel, okay, he's got good staff. He's got solid staff, okay? They're going to have his back. But in these corporate environments, you're in one day, they're gone the next. They pay them nothing. Part of their business model is to keep turning them over so they have the lowest cost overhead in employee salaries possible. lowest benefits. They don't pay them benefits because they turn them over every 6 months. And those
Yeah,
people, doctor, those people are not going to have your back with a patient. They're there for the paycheck and then out the door.
you know what drives me nuts is I can't figure out how it's even possible to have a guy sitting, let's say, I don't know, in the next state or, 30 blocks away in a corporate office that knows zero about healthcare or dentistry, to be more specific when it comes to us dentists, telling a dentist, today you're going to be doing this quarter, that quarter. I mean, that encourages for the doctor, for the provider to rush unnecessarily in order to make a living. And when you start rushing to compensate for lower fees to produce more, guess what? I mean, you can't have your cake and eat it too. The rushing, you start sacrificing patient care. I don't care how you slice it and dice it. And then your name is your signature of your work. Long term, if you stay long enough with one of these operations, you're going to burn out. You're going to not enjoy being a dentist. And I tell you, I take a lot of pride in one thing. I think different people, different providers, everybody has their own idea of what happiness is. Everyone has an idea of what financial success may be. For some of you, it's say for you, gross $2 million a year. Well, if you gross $2 million a year and your overhead expenses is 2.1 million, I'm going to tell you, you got a problem. So sometimes I hear colleagues and they mention, well, I gross this much, I gross that much, I took in that much. Tell me what the bottom line is after you subtract all the overhead. So if you're running a practice where you have 20 staff members, you can be grossing 2 million, and I can guarantee you're not bringing too much of that 2 million home. So I have a completely different structure in my practice. I run a very small operation that's very efficient. And I'm very happy doing it. Now, which way the provider, wants to structure your life, especially for the younger folks, it's really, you have to sit down and do a little brain searching or brainstorming and ask yourself a fundamental question. What do I want out of my career? How do I foresee enjoying my life in this career? And do a lot of soul searching and come up with how do you want to structure your life. I have had certainly colleagues who went into the military and served in the military as dentists, and they retired with very nice pensions at a very early age while they still work as dentists. So that's something to consider. I think for the younger folk out there, for the younger guys, in my humble opinion, you want to associate yourself with a reputable provider. Learn from them. There's many things that they don't teach you in professional school, regardless of what field of specialty we're talking about here. So learn from your mentor, as Dr. Davis said earlier, grow with your skill sets, and then start considering the next step. How do you go on your own? And be cautious. You cannot take everyone for their face value of their word when you enter business deals, when you join practices, when you decide to take on partners. I mean, I've tried some things that for me personally didn't work out. So
we all do.
Yeah. Please, share your story that, some
we
of the
all
stuff
do.
you've experienced.
We all make mistakes, and sometimes horrific mistakes. I remember I retained a consultant, and I thought he was acting strictly as my advocate when I bought a certain practice. And no, he was running a back end deal against me, getting money on the back end from another party. The practice had basically been repoed by the bank. The bank was the major party I paid the money to. I won't give any names, but let's just say the doctor had a problem with drugs, and I was totally unaware of it. The consultant knew it all. This consultant has a history, and they've been around since forever. This person is known in the dental industry, and he's as dirty as they come. They don't come any dirtier. And you don't know this. You don't know this going in.
There are unfortunately some dirty players which are out there, and they really have no business being in our health community. But when you buy a practice for the younger guys out there, you have to ask yourself again many questions. Is it an ethnic practice? And why do I say ethnic practice? Because if you purchase a practice that's centered around a particular ethnicity, you may lose or not retain all the patients that you hope to retain. It depends on the location of the practice. Where is it? What type of practice is it? Is it a fee-for-service practice? Is it an insurance practice? You have to look at all the detail and to again ask yourself, is this the kind of practice that I want to develop further? And it's not easy. It's not as easy as 1, 2, 3 to find everything that sort of fits mostly with your with the profile that you're seeking to get yourself involved in professionally. So these are all things I think for the younger guys. You have to examine and you have to work with people that know what they're doing, such as Dr. Davis, and they can guide you and tutor you as to some realistic issues that you may face.
When Pavel talks about guys, he absolutely means guys and gals. He means our fellow. I know that, but I want to make that very clear to our audience that we 100% respect the females in our professions.
Sure.
They are co-equals with us. We use them as specialists. We use them as trusted colleagues. We use them as mentors, male or female. Guys means guys and ladies.
You know, it's funny you say this because when I went to school, I graduated in 93. So my class was, I believe, almost 50-50, men and women. So when I say guys, I'm not saying absolutely. Right. I mean, I'm glad you corrected and cleared up the point.
I'm not correcting. I'm just
because guys is I'm saying you, men and women, everybody, and everybody in the middle too. How about we say that too? These days, you know, everybody. You know,
fine by me. Fine by me. You're one of my colleagues. I love you. We're going to work with you.
That's correct.
And whatever background, whatever race, creed, religion, I don't care. None of that matters. What does matter is what's in your heart. Are you there for the doctor-patient relationship? Are you there to grow? Are you there to be the best doctor you can be? And is the best doctor you can be going to be better tomorrow than it is today? Because you're on a continual growth path. I love that. That's where I need to be with my colleagues, not with who can produce the most. Ridiculous. Who cares? Who has the nicest marble or granite in their office? Irrelevant. Who can sell the most this antibiotic treatments that they put into the gingival tissue? Who can sell the most? Come on, it's not what it's about. It's not what it's about. Who can who can work to get to know their patients on a personal level and be of maximal service to their patients. It's about being of service to others. You will do well if you are of service to others. You may make more money the other way, but what it'll do to it'll eat you up. It'll eat you up in ways that you don't even know yet. You don't know that. It'll eat your heart away. It'll eat your stomach lining away, your stress levels, relationships with family. It can destroy relationship with family if you are incongruent with your values and what you're doing to other people at work. And there's a disconnect between what you are doing and what your ethics are in your heart. You can't do that, not long term, without some serious ramifications. And they're not pretty. They're terrible. It will eat you up.
I think one thing I'd like to also bring to the table, and again, a lot of the stuff I say here, guys, is coming from my heart, from my experience. Again, I've been doing this almost 30 years. And one problem that I had in the beginning, I was stuck between my walls. You know, I was like a horse. I was going to work, coming home, going to work, coming home. I wasn't spending much time in continuing education. And then I started teaching, and I got involved in the teaching environment, and I started taking more courses. And I highly recommend to the younger folks out there, educate yourselves while you're young, because dentistry as a core hasn't changed all that much aside from new technologies, computer-wise, softwares, materials. But root canal is still a root canal. What I'm saying is there's so much to learn these days, and we really are fortunate to have it now at the fingertips of our computers, in our phones. So with global summits, this constant learning that I've been doing personally for last year, you get to learn so many techniques, so many different ways of doing this, doing that, from very educated people that have been doing this for a long time, very often people that have been published. So I think it's imperative for a successful career not to wait until you're 50 years old like me, and I'm lying about my age a little bit. Start early, educate yourself, find your niche, find what you enjoy doing the most in your practice, and maybe grow your practice within that sector. It may be aesthetic dentistry, it may be crown and bridge, it may be implantology. So there's again so much. Try to focus your energy and your abilities into getting better and better at what you do by constantly learning. And as most of you see, all of us are here sharing willingly and freely, and that's one of the main things that the D2D movement is about. It's about unity. It's about becoming better clinicians. It's about putting aside all the other stuff going around in the globe that's so turbulent, and us being one big family, which we all are, namely healthcare providers. And we, I think it's extremely important to have colleagues we look up to, such as Dr. Davis, who can share with us his expertise in so many levels. So, Dr. Davis, I mean, if you can, off the top of your head, give a little bit of a, let's say, a flow chart or a little stepping stone from how a new graduate should try to gear their life forward, what would it be? How would you characterize that?
It's going to depend a lot on how you got through school. And I'm going to go right back to debt. How much debt do you have? You want to minimize that debt even as a student. Now, I know the recruiters to the dental schools, they don't talk much about that. It's a critical factor. You've got to graduate with the least amount of debt feasible, and then maintain a lifestyle for a number of years thereafter that is fairly modest, and get that debt burden off your back. That's crushing all of our professions. It's brutal, and it can be used to manipulate you. It can be used to put you into basically debt servitude. So basically, you're working in a situation of bondage just to pay back that debt. All right, now let's look at some of the options when you're there. You're going to get out of dental school. Certainly, one of the options is to work public health clinics, federally qualified health centers. Some of them are legit. I'm going to tell you, a lot of them are not. They are scams. You may get, we're going to help finance your student loan debt. And you come to look at the bottom line is, it's going to pay back about $20,000 a year. That barely covers my debt service, my interest on debt. That's not good. That's number one. Number two is a lot of them are running what we call mills. They do it on patient encounter fees, and they just patient churning. And so they maximize the number of visits. You can't do a quadrant of fillings. You got to do one filling at a time. Why? Because they get paid by the government for each patient encounter. And there's been lawsuits over this. Doctor, you do not want to be involved with one of these outfits. And believe me, just like the corporates, these nonprofits, those directors, they're getting well into six figures, sometimes 7-figure annual salaries. They're making serious money. It's not you. They're the parasites. All right. They're sucking the blood of the dental profession. And I don't like it. Just like the corporate people do. So that's an option, but make sure you gotta do your due diligence. Talk to doctors and see if you relate to those doctors who are working in those organizations. It's the same for corporate. I would like to see you work in maybe a smaller group, or the military is a wonderful option. Military is a great option. There's mentoring that goes on there. The education is really pushed. There's actually a few of the DSOs, a minority, not many, that do push education. You want to get more education. More education you get means the more services you can provide for your patients. Yes, you can earn more money, but being of greater service to the public, I think, is going to be your ultimate goal. I think that's what's going to give you the greatest satisfaction. Being of service to others is like the highest calling feasible. You go back to the teachings of Gandhi or the Bodhisattva. Forget, I don't want to get religious, but being of service to others is a tremendous, it's a tremendous thing in your life. But without the continuing education, you're not going to be in that position as easily. So it's imperative, doctor, that you make that commitment to a lifelong study of continuing education. And if your employer can help you with that, all the better. You do have a number of options, but I hate to see you get sucked in by they're always looking for, it's the same companies. They're always looking for new grads because they churn over their employees so fast. They go through doctors every 6 to 12 months. Boom, 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 boom. And those employment contracts, you need an attorney, not any attorney, one specialized in that field. If it's medicine, with medical service organizations, dentistry, dental service organizations, you need a specialized attorney who knows that, those contracts. And nothing's boilerplate, nothing. All right. And a good company, you can negotiate some things. Some of the companies are take it or leave it, because all they want to do is screw you over. And then if you won't take it, we'll get somebody who will, because the schools just keep pumping out the students, pumping out the grads. This is wrong. There's a big glut of doctors on the market. This is not good. This hurts us all.
It's a revolving door, in other words. It's a revolving door.
Right.
They're taking in young ones. As soon as they start to grow slightly and where they have to increase their pay, they get rid of them. They hire the next one.
Right. That's right. As long as they can keep producing at big numbers for them. That's all the corporate boys care about. They want next quarter's return, and then they can sell the DSO, sell it off to the next private equity company, and it'll be in the portfolio of the next company. And every time they roll it over, they make a chunk of money. It's based on a percentage of EBITDA and earnings before taxes, interest, amortization. That's what they want. Maximize that through any means feasible, any means. Cheaper labs, cheaper supplies, cheaper employees, any means possible. And they run them, the call centers or some, they're doing diagnosis and treatment planning from freaking call centers. The people may not even have a high school education, and they're doing treatment planning over the phone from call centers. It's disgusting.
So what happens to the quality of healthcare? It goes.
It's in the toilet.
Correct.
And then, doctor, you're part of it. And believe me, those corporate boys, the first thing they're going to say when they've got a prosecutor banging at their door, we're not doctors. We don't know anything about it. You'll have to speak to the doctor at that clinic. And doctor, that's you. You're going to be the one they throw under the bus. And guess what? Your attorney that you think represents you is paid for by the DSO. That attorney may or may not be representing your interests, maybe representing behind your back the interests of the DSO. And I've seen that too many times where they've just screwed over the doctors. It's ugly stuff. You cannot trust these people. They're not to be trusted.
It's amazing. It's amazing stuff, and it takes, I guess, a lot of courage to be able to discuss this with our colleagues, because so many, I think, so many of us in healthcare, sometimes we have this fear to express certain of our worries and concerns, because we feel no one would understand, and that's why I'm so grateful to Global Summits for launching this entire platform, where we could sit down and as healthcare providers and talk about important issues, whether it be insurance companies, whether it be patient care and quality of care. We could really exchange knowledge on a global level, and hopefully make the profession a better place for everyone and for our patients.
I want to
Uh,
bring up one issue. You
yeah,
mentioned insurance. I'm
please.
going to make one specific. This is going to apply to somebody who's listening to this right now, and you can do this. I'm on the State Dental Association House of Delegates as well. Or one of the things I introduced, and it became part of the State Dental Practice Act. It was upheld within the state Supreme Court. There's several things, but I was a little bit of a part of it. But it was that the people who review to review an insurance claim in my state, you must be a licensed dentist in my state. Therefore, you are subject to review by the state dental board. Therefore, you understand where I'm going with this. So if you're just denying delay for no reasonable reason, whoever that insurance company has assigned as their dental director for claims review for my state, you're before the board. They don't like that. They don't like that. And a lot of these companies, they don't have a dentist even reviewing the claim. They don't. That's just a fact. Maybe a hygienist, maybe a former dental assistant, maybe somebody with no dental experience whatsoever. So what does that look like before a board? Well, that's called the unlicensed and unlawful practice of dentistry. Where does that get you? Well, that goes up the corporate chain. That goes right up the corporate chain. Okay, that's fraud. That's False Claims Act. That's treble damages. That gets exciting.
Yeah, these are territories, I guess, they're not fun for doctors to get into and to face in their lives.
But when you're dealing with the insurance industry, it's hardball.
Yeah,
it's hardball. There's suits going on. I won't mention the company, but there's a major class action going right now with the doctors against one of the major dental insurance carriers. And I can't get into specifics. I've been given certain data, but these guys they play hardball. And you think that let's say an insurance company is established as a nonprofit, a 501c. Well, they don't work as a nonprofit. Those directors are making many hundreds of thousands of dollars annually, if not $1 million a year, and their perks are outrageous. These guys live like kings. Kings, I'd say kings and queens. There's a few women involved, but it's outrageous, and they're just a parasite on us and our doctor-patient relationship. That money could go back to the patients and lower premium costs. It could go back to the patients in a greater range of service or greater remuneration per service. It doesn't. It goes into the pockets of these people who are directors of these nonprofit insurance companies. It's absolutely outrageous. And doctors have every right to be upset by this. We see some doctors, there's a group in Kansas that I'm very proud of that's fighting this right now as we speak. There's a group of dentists in Washington State that have been fighting this for years. There's another group in Massachusetts that's been fighting this for years. I won't get into specifics, but there are good men and women out there that are fighting noble battles, that are out there to really promote the doctor-patient relationship and get these third parties the heck out of the way. We don't need intrusion into the doctor-patient relationship by these third parties, be the insurance industry, a DSO, the private equity industry, some government bureaucrat that's just a half-baked policymaker. I mean, they're pathetic.
I don't see why very often when we're faced with having to speak with an insurance company and the doctor requests to speak with the dental consultant who declined your claim, they don't let you.
No,
Or they don't, or they don't let you even know his name.
His
so
name? It could be
his name, her name, its name, whatever you want to
Sally
call
Hernandez.
it.
And Sally is, she didn't quite get through high school, but it's all right.
It's crazy.
And she's going to do exactly what she's told to do.
Of course.
She's told to deny so many claims per month. He or she is going to do that.
And that transforms into millions of dollars.
Means more cash float on the money for the insurance company. Now, when you look deeper into those insurance companies, especially certain nonprofit ones, well, you'd think they would put their cash float into things like blue chip corporate bonds, safe investments. Oh, no. Oh, no. Some of them are putting their money into very, very high speculative venture capital games. And I suspect it's a way to kick back even more money to the directors. It's ugly stuff. These companies are dirty at their core.
Amazing stuff. Amazing stuff. Dr. Davis, I think we're starting to run into the end of the show, the time. I think let's slowly start to see if we have any questions from the audience, and if there's anything else on a final note you'd like to share with our audience. And we have two more exciting partners lined up right after this one. So we all hope you guys will join us for those as well.
And I hope you all know, when you're listening to this, we want the best for you. We do.
Yeah.
This dental field, it's hard, it's demanding, it's challenging. You're working in a tiny place. People have fears, anxieties. They come to you, and we treat them mostly consciously, not with sedation, mostly with conscious treatment. That is very demanding on our bodies, on our minds, our emotions. This is very, very demanding. And we do not need the intrusion of these third parties. We don't need it. It's hard enough as it is without these, and it's fair. Parasites, that's a fair term. Bloodsuckers, fair term. Leeches, fair term. We don't need them.
Yeah, I completely agree with you. And I think it's gotten too far, and it's time for it to come to an end. I think dentistry is in medicine and healthcare. Whatever we do, it's an art form. We are artists, and you cannot be an artist if there's 10 artists involved in the kitchen. Of course, it's perfectly fine to use specialists in a close-knit circle and work together as a team for the best quality of care we can provide. But once you start getting 20 artists trying to paint one painting, you end up it's not going to be a Picasso. So I think in healthcare, we need to educate ourselves,
3-year-old
educate our
painting
patients
up on the refrigerator wall,
and really grow and know and love our patients and treat them with dignity and respect, and really provide them with the standards of care that we have in our fingertips. So,
when you treat them with that love and respect and courtesy, when you treat them with that, yes, I know that goes to the patient, and it also goes to the profession. It could be medicine, dentistry, podiatry, pharmacy. Yes, it goes there as well. But you know what? That also comes back on you. When you show that love or that courtesy, that respect, that dignity to the patient, that comes right back to you. That'll bounce right back to you. I know for a young doc that doesn't even make sense. It doesn't, but it's the truth. I know you don't see it right now, but it's true. The love, respect, dignity that you're showing your patient, that's going to come right back to you. And it's going to enrich your life. But how do you take that from me on face value? I don't know. How do you take that from me just on what I'm saying, just on trust? It will come to you.
Well, listen, Dr. Davis, it's really been a pleasure to get to know you and for you to share your wisdom with us. And now I definitely consider you a friend and a very dear
Thank you.
friend to my heart,
Of
because
course.
I think you're a fine person with fine abilities, and there's many things that I certainly want to learn from you further after the show and get to know you. So, guys, do we have any questions from the audience for Dr. Davis, or anyone wants to ask anything? Feel free. I don't see any comments here on my end. Dr. Davis, do you see any questions from
I
the
see
audience?
nothing.
Nothing. All right, guys. So it's about 11:10. We're towards the end of our show. And again, on behalf of Global Summits, Dr. Shah and myself, and Dr. Davis, we thank you for joining us today. We are here for you. Feel free to call Dr. Davis or email him if you have any questions, or you need an expert witness. He's an
We have
expert
my
in this
email
field.
posted so these docs, because
Yeah.
some of these things are very close to their hearts, and they broke their hearts. I've talked to many doctors who talk to me in their tears and the tragedies they've gone through. They're not necessarily going to be, they're going to be somewhat reticent to share some of these personal things. So they can email me. Absolutely. And I want to make sure, is my email up, or I don't know how we can get that up. Can Anshul get that up for us?
I think we'll put it in the comment section.
Good.
Yeah. So thank you so much for joining us and for finding the time. And once again, thanks to our audience, and happy holiday, and enjoy the weekend, guys. And we'll see you in about 45 minutes for the next show. All right. As always, from the VGO man.